and hopefully we will also have time to open it up for more questions. But I'll come and grab your questions.
Okay, SNAP. We have a question about SNAP. Please explain how SNAP works, what someone can and cannot purchase. How are SNAP recipients affected now with the One Big Beautiful Bill? And how will they be affected later on in 2027? I think many of the things in the bill that just passed are not going to be implemented till 2027 or 2029. You know, it's out in the future. It's going to be phased in over time. So, SNAP.
So SNAP is utilized to purchase food products of any sort that nourish your family. They can't buy toiletries, you can't purchase things like alcohol or cigarettes or feminine hygiene products or toothbrushes. You can't purchase anything like that with SNAP, but you can purchase any food product, right? Nothing prepared, you can't go and get pizza from the local pizza shop, but you can buy lunch meat, or you can buy a frozen pizza if you choose to.
The other part was,
Yes.
how will it be affected in the future, going forward?
So going forward, SNAP eligibility will likely be shrunk a little bit. So what we know is that there are lots of abilities to write off your housing, to write off your utilities expenses when you apply for SNAP. And base amounts of SNAP in New York State are $23. That's the minimum amount of SNAP that you might get if you qualify for SNAP. There was a motion this year to raise that minimum to $100. That did not make it into the budget this year. We're hopeful that that advocacy continues and that becomes a reality. Some of the SNAP impacts will begin this fall when the new budget is enacted. So that's in October. So the new budget starts in October. Some of those are going to begin now. There's a lot of work at the state level to figure out how that's going to look. And we don't have a lot of answers because people are still sifting through all of the paperwork. They're still sifting through the state level. So be paying attention as much as you can, and hopefully we'll be able to share information as it becomes available.
So I have to add to this question because I don't know what HEAP is. How is HEAP going to be affected? How about what is HEAP?
I don't run HEAP, so I will do the best I can. So HEAP is Heating and Energy Assistance Program, Home and Energy Assistance Program. That is an income-based program that assists individuals under a certain income with the cost of heating their homes. And so at this point, that program is slated to be completely eliminated across the board, and that is 100% federal funding. So today I was informed that we were told by, it's OTDA, Office of, do you know this one, Tanya? Temporary Disability Assistance. They're the ones that run HEAP within New York State, and they have received no information at the state level. So we are patiently waiting to get more information on that.
SNAP used to be food stamps. In case you're used to food stamps, SNAP is the new name for it.
Okay, these two kind of go together. We're hearing that Medicaid is going to be reduced. How might New York State make up that difference, or who else would, who else would fill in if Medicaid doesn't provide things anymore?
I can take that in part. So I'll talk about one provision that's going to happen probably the quickest, of which New York State is going to have to, first of all, New York State is going to have to make decisions of whether they are going to continue to fund at the full level or whether they are going to have to make cuts to health care and benefits. But in particular, and I'll just point out one thing, is that The first thing to fall on this bill is an eligibility restriction for essential plans, so that's the expanded population in New York State, that is based on citizenship. So there is a regulation that right now, people who are legally here in the United States, who are in their 5-year waiting period to become a full citizen, is eligible for either tax credits and to be in the essential plan. So that has been rescinded. So that eligibility has been rescinded by the federal government. New York State's constitution mandates that that population needs to be covered. So in terms of projected New York State impact, they are estimating that that is going to be a $7.5 billion loss in federal funding to New York State, of which they are going to have to cover. So they will find, yes, sir.
I was just waiting for you to finish. I was on a call with the Every Life Foundation. They were talking about how the big beautiful bill impacts rare disorders, people who have rare disorders today. And to your point, the beautiful bill limits how a state can raise money for the Medicare match, because Medicaid it's a handshake. States pay in, they get matched by the federal government, and the bill limits how the state can raise money for its half for the match. And one of the things they were talking about was taxing hospitals. And so it's just, this thing is just, it's just meant to constrict Medicaid, and it really reduces the way the states can pay for it and come up with their end of the match. And it's not so much now, everybody's the state will kind of make up the difference now, but trying to figure out how to live with it is what's coming up.
Yes.
Yes.
Thank you.
I have another one here. Will Medicaid recipients be notified of changes to requirements? Like, how will the Medicaid recipients know how they are going to be affected?
I'm not sure. But again, it is up to the state. The state will be administering, and currently does, the Medicaid eligibility and enrollment process. So that's a big piece of it. You know, how are we going to tell our community members about the changes, and how are we going to support them re-enrolling when they need to re-enroll, and documenting what they need to document? Is that kind of what you understand how it works?
Yeah, so currently everybody, how I understand it as well, is that all Medicaid recipients have to recertify or be eligible every year. So you have to recertify and you have to re-enroll. That enrollment is now going to go to twice a year. So you're talking about an administrative burden on working families and our local government and CBOs that are enrolling participants. So
Severely understaffed already.
so that's really they do know, because you have to, it's not a forever program. So everybody is enrolling and certifying annually. That enrollment period is just going to be more often.
It's quite a process.
Cynthia?
I just want to highlight what Diane was talking about, that a lot of the money that we may be getting as a state is going to be used for administrative costs. So, and if we're having to do it twice a year, it's more going to the administrative costs. That's what I heard you say,
Okay.
as opposed to direct service.
I appreciate that people in the audience know their own things, and they know things beyond, perhaps what's being said here. But I really want us to stay focused on our presenters. Thank you. I want to stay focused on our presenters and keep mining them for their knowledge. Maggie, what other food pantries exist in our area besides in Evanston? Do you have a quick list, or are there other food resources besides food pantries?
So you can find your local food pantry at otsegohunger.com. That is our most updated pantry list run by the Hunger Coalition of Otsego County. And we continuously update that with local hours and changes and things like that. Almost every community in Otsego County has access to a food pantry that will serve them. And again, we go back to what we learned through COVID, and what we learned through COVID is that most of our neighbors need more support than once a month. That's just how that is. So that's what, finding your local resources and then utilizing extra resources like the mobile food pantry or SNAP sign-on or drive-through pantries, or all of those things are available to anyone who finds themselves needing an extra hand.
Okay, with cuts from the big bill expected to damage Planned Parenthood and similar organizations, what is the expected impact for access to health care and reproductive health in our area? What other sources exist?
Well, I'll try. Planned Parenthood nationwide serves many individuals, men and women, for essential health care needs, cancer screenings, as well as reproductive health related needs. My understanding is that by limiting any federal funding going to organizations that also provide abortion care, that care may be at risk. The survival of Planned Parenthood clinics may be at risk. That's my understanding. Locally, Family Planning of South Central New York, which has offices throughout the region, is not an abortion provider. So I do not believe, but I'm not 100% sure, that it would not be involved in this restriction. Does that answer your question, whoever's question it was?
So the additional resource might be the Family Planning of South Central New York. That's an additional resource that people have available to them here, right?
Yeah, Family Planning of South Central New York serves many people on an income basis. They do accept Medicaid, but also if people are uninsured or cannot pay, there's a sliding scale. And again, they also partner with the county to be the sexually transmitted disease clinic and with cancer screening. So yes, I think all of those services are likely to continue and maybe be even more important as people may lose their insurance.
So we have a local mayor in our audience tonight, and the mayor would like to know from maybe many of you, how can local governments best collaborate with your organization to benefit the citizens? Is there a way that government can get together with your organizations?
I think in a lot of ways we do. I mean, we're a small community, so if we don't work together, we don't get any of our stuff done. But I think in regards to smaller municipalities and things like that, I think sharing the information with residents, sometimes it's a lot of information. We have very thick resource directories and people's like, give us a resource list. It's not a page, it's hundreds of pages. But you guys have the experts in the community. We live here, we're residents here, and I think municipalities can certainly make sure, whether it's through the garbage truck companies who are picking up trash and can see isolated situations, to the post office delivery people, to the volunteer fire departments that are in all of our communities, and just making the information aware so that people know where to begin, getting them to the right spot so that they can get correct, accurate information instead of, inaccurate information by maybe people that don't have the right resources.
Do we have any FQHC hospitals in our area?
No. We have Bassett as part of their network has 5 rural health centers, which is a differently federally designated, but those are up in Herkimer County affiliated with Little Falls Hospitals. But we do not have any federally qualified health centers. As part of the Bassett Healthcare Network.
How will any of these changes affect people with developmental disabilities?
I know that Springbrook is heavily federal funded, but they have a lot of private funding too. So that's good news for them. But their reimbursements, I'm sure, are part of the cuts planned, so it will have financial impact on them. But I can't speak directly to the finance or services. I don't know if anyone on the panel can. Maybe Caroline?
So I don't know how deep this conversation really goes, but from a general perspective, right, we have a Medicaid population that is the traditional Medicaid, pregnant women, people with disabilities, children, and then you have an expanded population which occurred back through the Affordable Care Act. It is being said that Medicaid enrollees will not lose their coverage. What is going to happen, though, is that with the recertification and the eligibility, there may be slips, right? That's the concern, and that's where the gap is. The essential plan, expanded population gets a little bit more, it's a little trickier only because there are then work requirements. The work requirements are on the 19 to 64-year-old age bracket. It used to be 54. As part of this bill, they expanded that up to 64. And then redetermination. So I don't want to speak on behalf of Pathfinder or Springbrook or the disabled population at all, but it is widely considered that that population will be able to maintain its benefits.
If I understand that correctly, that means they have to have support filling out the proper paperwork, right?
Correct.
Okay. I think we briefly touched on this. If New York State decides not to reduce benefits through Medicaid, which you said are required by law, some of the things are required that they be provided, does that mean increased in taxes?
On the table.
Yep.
That's on the table. It's on the table. Okay. How effective is contacting federal and state representatives when canned responses are given based on the subject area? What's an alternative?
I advocate almost every day. They know my name. They will pick up the phone, because if they don't, I will call back. I will write. I will email. I encourage my staff to do it. I encourage the clients that we provide services for to do it, and I encourage you all to do it. Get in everybody's ear that will listen. They log. They called about this. They called about that. They called about this. They called that. And those numbers are very, very, very important. They may give you a stock canned response, but you will become, unfortunately, a tick in those numbers, which is only good for us. For you, for the community, for the organizations throughout the counties that we serve. So please reach out to your elected officials. Not once, not twice, 10 times if you got the time, 20 times if you have a lot of time, 50 times if you got nothing better to do and have your cell phone.
I think I want to add to that canned responses are also okay. They get tick marked as well. They'll say, oh, we got 17 paragraphs, from this one topic or from this one group or whatever. They keep track. They keep track.
And you don't have to be an expert. You don't have to know it. I mean, you don't have to be an expert on it. You have to call.
You can have an opinion. You're allowed to have an opinion, right? You all have an
Yeah.
opinion.
And And they want to hear from you more than they want to hear from me or Tanya, because that's our job.
Well, here's an interesting one. What's your single worst nightmare? Do we really?
In a work aspect, or?
Public services.
Public service.
Okay, right now, to sum it up, the biggest nightmare for me is the unknown. Because every day something changes, some new regulation comes out, some new guidance comes out, then it gets rescinded, then there's an executive order, then the state's response is this.
And then
It
there's
is
a lawsuit.
Yeah, and then it's paused because of this or that. So the biggest nightmare for our organization and the clients that we serve and my staff is just, in one word, the unknown at this point.
I
Well,
think
keep
that
going.
sounds, I was gonna say, I
Worst
think that truly is it, is that we don't know what's next, we don't know how to plan or how to prep or what we should be expecting. And that's horrifying for the communities that we serve.
I think my biggest nightmare is more and more people will not have access to health care. I think not having insurance limits people's ability and comfort with showing up, and we'll see more people with advanced diseases. And there are even estimates out there that more people will die. So that's what worries me.
Mine is the same as well as the delay of care. Not only in this situation, but that people delay their care generally. And we know we live in a rural area, we know that getting 2 appointments is difficult, but really urge people to not delay their care because it will get worse and it gets more expensive. Not to put a number on it, but I mean, it doesn't save anybody delaying your care.
For us, it's apathy, and I think unfortunately we've seen a lot of it after COVID. People just sitting back and not doing anything and then complaining when something happens. So for us, take charge of your life, take control of how you live, and be proactive and don't sit back and wait for somebody else to take care of you. So that's, yeah, be strong advocates for yourself.
Do we have any local hospitals participating in 340B drug pricing programs?
Yes.
I don't understand the rest of this about the disproportionate share of
Yes.
hospital program. I don't know what that is.
So yes, Bassett takes advantage of 340B, and it is a significant revenue generator for us that allows us to support services of which are not revenue generators. Primary care, behavioral health, school-based health. So 340B is essential to Bassett's operation. What it is it's a negotiation, we are able to buy drugs at a discounted rate, and then we basically get, instead of the middleman, we get to keep the difference between the wholesale price and the retail price. And so that allows us to reinvest in our healthcare system. Disproportionate share is a federal program that goes through New York State. We take care of a disproportionately share of Medicaid patients that go through, and it's counted on bed days. I'm going to get in the weeds, you don't want me talking.
So that kind of wraps up the written questions, but I know that some people may have a burning question that they just didn't want to write about. So I'm going to open the floor to maybe 3 or 4 questions from you guys, but I want to caution you, make sure you give me a question, not your opinion about all this stuff. Make sure that you're asking something, okay?
Hi, my understanding is past the federal, and now we really need to lobby the state people. I'm going to say something that some people might not like to hear. This was put through on the federal level by Republicans. Our state senator and our assemblymen are Republicans. Can we depend on them to actually do anything for us?
I'm a little bit confused. So
In other words, we're gonna lobby this, our local governments. Our local governments are ran by Republicans who pass this kind of stuff. How?
I mean, just,
I'm getting apathy, basically, the right word for it, because
No,
they don't answer my letters either.
So our federal representatives, at least for the Bassett Healthcare Network, are
Right.
split. Elise Stefanik in the North Country is a Republican. Josh Riley is a Democrat,
Right.
both of our
Right,
senators. So
okay,
they
so
are,
that doesn't address New York State taxes.
New York State, he's looking at the state level, state level.
State,
okay,
State level.
because the state's gonna have to pick up
Yeah,
this.
he's saying.
okay, so I'm sorry, then I,
He wants to know, what do we do, because
okay,
I
yes.
think to rephrase it, he's saying Republicans were the one who put this in place, and locally in our rural area, we are represented on the state level by mostly Republicans who have been elected. So what do we do about that? We tell them what we think. We call them, we write to them, we get things in the newspaper, you know, Republican, Democrat doesn't matter. We're talking about people and issues that affect people here. And they work for us. We elected them. If you really don't like it, vote for somebody different next time. Get your friends to run for office. Get young people in there. Get, just somebody different. I mean, your vote really counts. Your phone calls count. The Republican, Democrat doesn't matter. We're talking about
I think it
people.
does this time, it
Think
does,
it does?
yes,
I think they will tally things.
doesn't matter.
He's talking about,
So my question is, the SNAP coupons for generally seniors for this year, are they still available, or was the program already cut pretty seriously? 'Cause I know that.
The farmer's market coupons?
Yeah, yeah.
Yeah, those are active. We actually finally got them in our office 2 days ago. They're a little bit late, but they are, yes, that's a fully funded, fully running program right now. Yep, yep,
Good news. Thank
yes.
you. Thank you.
You don't need a microphone.
Hi, thank you. So what are these work requirements?
Well, do you want to
Yeah,
talk about
I need
it?
a-
What exactly are they?
so, I have a little, I wrote it down, it's pretty complicated, okay. So, Medicaid, as it exists now, has no work requirements. It wasn't envisioned that way, and it hasn't been that way. In place with this bill is a requirement for states to condition Medicaid eligibility for individuals ages 19 to 64 applying for coverage or enrolled through the ACA expansion group on working or participating in qualified activities for at least 80 hours per month, effective date being no later than December 31, 2026. Now, there are many exclusions, so that if you're at home caring for young ones, and actually the Senate version raised the age to 13, but if you have a 15-year-old that's disabled, you may not be excluded. So, I mean, it's not perfect, but there are many exclusions. If you're attending school, if you're ill or disabled, community service counts, and it's estimated that 92% of people receiving Medicaid now either are working full or part-time or would have an exclusion. So part of the cost savings really comes in the continued need to document all that and to administer all that from the state. That's my understanding. But that's a brief explanation of work requirements. There is evidence that shows work and reporting requirements are confusing and complex and costly for states to implement. And research also shows that access to affordable health insurance and care promotes individuals' ability to maintain and obtain employment. So, importantly, the CBO estimates work requirements show lower federal spending and an increased number of the uninsured, but no increase in employment. So that's work requirements. Do you have other questions about it? That's a very brief summary. It's pretty complex. So back in first Trump administration, a number of states applied for waivers in order to impose these sorts of requirements on Medicaid recipients. At the present time, only Georgia has such a requirement in place, and my understanding is that is how the federal government is modeling some of their plans for this. It didn't work in many states because what happened was many people lost insurance that actually should not have, just because of all the administrative hurdles.
I think we just have time for one more. Just one. Is it a good one?
Actually, it's not a question, it's a news for you all. Okay.
No, it's I don't know what it is. She's in charge of this organization. Oh, sorry.
Thank you. First of all, I want to apologize because of my broken English, but given this news today, I just wanted you to know that I'm here as a representative of the Oneonta Community Health Center. We are a free clinic. We are located in Oneonta, and we provide primary care for uninsured and underinsured people. And I just want you to know we are here to help this community, and we are willing to serve whichever are in need of our services. Thank you so much.
That's actually a very positive note to end on.
We have another community organization.
Another community organization, okay.
Hi, my name is Valerie. I work with Catholic Charities, and I assist people in applying for SNAP benefits. I help you with existing SNAP applications if you're having trouble, you don't understand if you qualify, how to go about recertifying or other questions. Totally free. I'll leave cards.
Thank you, Valerie. This is like another side benefit. Other organizations and other connections are going to merge to support us as neighbors and friends of each other. I would like first for you to give applause to yourselves for attending and becoming informed and participating in your democracy by being here tonight.